B, Mental Health Support Services Annual Update, Ms. Krajewski and Ms. Freed.
Good afternoon, Mr. Chair, Vice Chair, members of the board, Dr. Casey. I am Jen Krajewski, and I have the privilege of serving as the chair of the Community Services Board for this year. I'm going to keep my remarks really short so I can, for the sake of time, so that Kelly has time to go over everything. But I did want to take a minute just to recognize our other board members who are here today. Our board members wanted to come to show our thanks and appreciation for your continued support for everything that the Community Services Board and Mental Health Support Services does. So with that, I'm going to go ahead and turn it right over to Kelly.
All right, thanks so much, Jen. Good afternoon, Mr. Chairman, members of the board, Dr. Casey. It is my privilege to present our afternoon annual report. I will try to just hit the highlights in the sake of time and just keep us moving. So as you know, the mission of our department is to promote good health recovery outcomes for those with mental health, substance use, and intellectual disabilities. The picture references a recent graduate of our Families First program, and it's always great to see kids being successful as they move on to kindergarten. Just briefly talking about numbers served. Last year, we served about 8,100 folks. Of course, we touched another about 15,000 through our prevention programs. There's one piece of data that we entered this time, or included this time, which I think is very important to point out, and that's the number of intakes that we received just over the last year. There were over 2,061 intakes. Doesn't mean that individuals didn't previously receive our services and decide to come back, but that's a lot of new intakes within the past year. Going over our budget quickly, our budget right now, the budgeted revenue is about $64.9 million. Of that, $30.1 million represents Medicaid, followed by the county's contribution of $16.8 million, and then we have additional state and federal funds. One item to note is that we have seen a reduction in funding of about $150,000 in this FY26 budget over FY25, mainly because of some ARPA funding that we know was terminating in early 25, and then had some funding award decreases of about $50,000 in some of our other programs. It is important to note that of the $64.9 million budget, over half of the expenditures, or the majority of the expenditures, are for individuals with developmental and intellectual disabilities, followed by mental health, and then substance abuse or substance use comes in after that. About 11% of our budget goes towards administrative expenses, which is consistent, administrative support, which is consistent with what we have seen for prior years. But what's really important to note is of all of our FY26 additional funding requests, we were able to cover those by outside revenue with no charge to the general fund. Employee engagement is always important to us, and so these are some of our events over the past year. April was Autism Awareness Month, and of course, not only did our department support that by wearing blue, but a lot of county departments joined in, and county administration did that as well, so we really do appreciate their support in our efforts. And then, of course, we always have a very popular multicultural food festival in the spring, and we have staff that do cultural demonstrations. Everybody brings in food representing their cultures or something that's very important to their family, and it's always a big hit throughout the year. We did receive 2 NACO awards. One was for our infant and toddler play group. The team recognized early on after COVID that some of the delays that were happening with children, especially around socialization due to being kept in the home for long periods of time, and so they developed a group in English and Spanish that's been very popular. It's a 6-week group that's held at the Children's Museum, and it's been very instrumental for families in trying to increase socialization. Also, our second NACO award was around promoting emergency behavioral response. There was a huge 988 campaign statewide that we were part of. We had lots of events over a period of about 3 months. And as you'll see later in the presentation, I think this is really what's helped the promotion of the number of responses that we've seen in Chesterfield through the use of 988 over the past year. Another key highlight that we're very proud of, I don't know if individuals have seen the Department of Behavioral Health dental bus. It will come to our county complex a couple of times a year. It actually provides free dental services to a lot of our individuals. I think we've served 90 over the past, or they've served 90 over the past couple of years. The bus actually parks in Mims Loop, and so I'd like to thank John Neal and General Services for always providing the space for the bus to come. It stays there. There's ample parking for our individuals or our staff to bring our individuals in to be able to receive these services. A lot of individuals with intellectual disabilities really have a challenging time going to a dentist. They just, often have to be sedated and so forth. And so this provides a different level of care than they might receive on a regular basis.
Is this on top of what dental services they have at Lucy Corps that they offer because when I took the tour there, they had the dental area there that they were doing free dental also.
This is totally separate. This is specifically for the individuals that we serve.
Okay.
And they provide full array of dental services, x-rays, the whole thing. And now these individuals are on a 6-month rotation as well. So it's just been a tremendous program. I'd like to recognize David Meadows. He's here, our Assistant Director for Community Services, for spearheading this program for us. Housing partnerships, you all have been tremendous over the last few years to support our partnerships that we currently have been engaged in, and they're now coming to fruition. Back in April, Horner Run had their ribbon cutting ceremony, and I'm pleased to report that we have now placed 11 individuals into apartments. Through our original partnership, we were working with them for 8 units. Which are all filled now, but we had additional 3 individuals who could qualify on their own, which was really a success. So that's why we have 11 units that are occupied by the residents that we serve. We're currently qualifying and housing the individuals for Lambert's Landing, so we're going to have up to 6 individuals that can occupy 3 apartments. Right now, we're working with 3. And then with the recent groundbreaking with Colebrook that occurred in August, we have the potential for 14 more units coming up. That's part of our housing services. We have a strong permanent supportive housing program that we've talked about. This program is fully funded by the Department of Behavioral Health and Developmental Services. We receive ongoing funding to support these services, and when we first started out, they allotted us 30 slots for individuals, and that has now increased to 45 slots. Looking at the outcomes here, since 22, we have housed 42 individuals within this program. Some of the things I'd like to point out here, though, that's really amazing is out of these 42 placements, we have only had 1 eviction. We've had 0 discharges due to behavioral health issues. 100% have health insurance, which is huge. 89% now have a primary care physician. These are really, big health outcomes. And then, of course, Chesterfield has been deemed as #1 statewide in housing stability for this program, so we're very proud of that accomplishment. The young lady that you see here, she actually was having a real issue of being in and out of hospitals, chronic homelessness. Her family, had some challenges and didn't want her staying with them. And she has been housed through this program since 2023, stably housed. She's now paying her rent. She's attending Chester House and no hospitalization. So she's been a huge success story as well. September is Recovery Month, so we always want to talk a little bit about some of the substance use statistics that we're seeing. In 2024, 53 people lost their lives in Chesterfield from a drug poisoning event, which does represent a decrease in 2023, so that is positive. Of course, there's a combination for what we attribute to the decreases, and that is the availability of naloxone that we have just, well throughout the county, easy access to treatment, increased access to medication-assisted treatment that we have in many of our county departments, and then, of course, community tolerance levels. Opioid-related deaths accounted for 73% of the total overdose deaths within the county. We do continue to see the drug supply being contaminated. Xylazine continues to be an issue. And this is the first year that xylazine was a regular part of testing for the medical examiner. But just to quickly talk about how we have tried to impact these efforts, over 4,000 boxes of Narcan were distributed by the CSB this past year. That does not include the distribution efforts that are occurring in the libraries, community corrections, Department of Social Services, and the jail. So there's many more boxes being delivered. We also have tried some things. We have what we call Narcan vending machines or naloxone distribution boxes. These are placed throughout the county in 4 different locations. We have one at Mental Health Support Services. There's one at the Department of Social Services, the jail, and also the courthouse. And approximately 600 naloxone kits have been distributed through these boxes. I think we're averaging can't remember how many a month, but it's quite a bit. And these are located outside of the facility, so folks don't have to walk in order to obtain it. They just need to drive in the parking lot and they'll see where they're located. In addition to this, you'll see our van. It's a mobile outreach van that goes out into the community, and through these efforts, they've distributed over 300 first aid wound kits, which is also very much needed for individuals affected by the xylazine ingestion. Over 4,000 fentanyl testing strips have been distributed, 10,000 condoms. We've had peer services to over 100 individuals in the community, and they've helped over 30 people either obtain or maintain recovery housing. So this van is becoming well-known. People see it coming, especially out in the community. They trust, the services that they're receiving, because it's not just receiving items, it's also being steered towards services as well. So again, all of these we think are really helping to contribute to reducing some of our overdoses. Chesterfield Recovery Academy. Today was a really special day. The First Lady actually came and did a tour at Chesterfield Recovery Academy and listened to some individuals tell some very powerful stories of the success of this program. We completed our 3rd year of operation and had 31 students served during the year. 7 graduated. Over 2,000 clinical sessions were provided to these individuals and 159 clinical recovery groups. So there's a lot of supports that are provided in the school system. In addition to that, we started this year, there's tons of partners that are now working with the program. Rams for Recovery comes every Friday and provides some peer services, and there's lots others who are providing support. But the school year this year started back with 18 students that are representing 7 localities, so it really has expanded. When we first started, it was primarily Chesterfield students who were attending the school, and now they're coming from New Kent and Charles City and Richmond and Henrico and Powhatan. So it's really taken off to be the regional school that it was envisioned to be.
Kelly, really quick question. What's the capacity of Chesterfield Recovery Academy?
They asked that today as part of that, and it was mentioned 40 to 50 students, given the complement of staff that we have right now. Seems a little bit high, because I think we originally were thinking around 25 students with the current staff that we have, but the model may be such that they can have a few more students now.
Is it a limiting factor of the staff or a limiting factor of the building?
Might be a little combination of both.
Okay.
Moving on, September is also Suicide Awareness Month, so staff have been busy participating in lots of community events. And I know Melissa Ackley, our prevention manager, recently participated in the Behind the Mic podcast. This slide actually shows the number of, suicide-related police calls, and then, of course, that's broken down by attempted and completed suicides. The orange bar represents juveniles as part of this. Overall, the numbers are looking better than they have before, all the way through 2024. We have seen a little bit of a trend this month upwards, and so we're continuing to monitor that. But all of the services that our department provides to the schools, as far as doing the signs of suicide classes and really providing a lot of supports in the community, has remained. And so we're hoping that that is aiding in helping these numbers in some
the
way.
past, we've seen say 65 or 70 plus also be a high percentage. I don't see that in here. Do we know how that's trending? Because that was concerning when last time we heard
I do
stats?
not know, but definitely can follow up on that.
If you could let us know, I'd just be curious, is with all the interventions we're doing now through the fire department and mobile services, that if that's helped with some of the elderly that we're also becoming,
Right.
into these situations. So.
Okay, I'll definitely follow up.
And it'll also be interesting with regard to the implementation of telehealth at the schools and to see what kind of impact they have too.
Right, great. Moving on to co-response, as we know, Marcus Alert legislation went into effect several years ago. We just completed our second year of following the protocols and implementing our co-response teams. Continues to be truly a success. As I mentioned before with the 988 calls and the campaign that occurred last year, when I presented last year, the 988 calls for Chesterfield were around 2,500. And if you look, there's 11,795 calls this past year. I actually just received the numbers for last month, and there were over 2,000 calls last month for Chesterfield for 988. So really is a success here in the number of calls that they're able to take on our behalf. Also, when you look at co-response, so to remind you, co-response is when our crisis team will go out with the police and try to stabilize somebody in the community that is having an acute behavioral response in the moment. There were 486 calls over the past year. We're averaging 40 a month. But when you look at the success, over 62% of these calls are being able to be stabilized or to receive services in the community without needing to be hospitalized. So again, this is what we want to see. An even better number is only 7 out of the 486 resulted in arrest, so that's less than 0.1%. Juveniles, we see it's a little bit higher than last year, so we're monitoring that. But when you look at the patrol hours saved, over 1,060 hours is a half-time position. That's one FTE, half of an FTE for the police. So thrilled about this. We now have 3 co-response teams now. We started with 2, we have 3, and we're quickly looking at whether we need to add a 4th team. So Chesterfield is the first to have more than 2 mobile response teams, so we have been given a lot of accolades about that. But I want to point out, because I'm going to quickly go over a success story in a minute, co-response is for those acute behavioral emergencies. You know, we want to be able to protect those police and mental health resources. But we get calls, not we, but the county gets calls all the time for individuals that we know are not doing well in the community. It may not be an acute crisis needing something right there in the moment that's from an emergency standpoint, but we know they're not functioning well. They may call county departments over and over again and express some needs. And so with that, the Sprint team was developed. This is it's called Strategic Planning Regarding Individuals in Need or Transition, so they just call it Sprint. But this is a multi-disciplinary and multi-county department team. They meet every single Tuesday. It's DSS, it's the Mobile Integrated Healthcare Team, it is mental health, it is police, it is, fire and EMS. It's so many departments that meet, and what they do is they staff cases for any calls, either that have been received that week, where somebody might need to go out and check on somebody, or it might be following along individuals just to make sure that they're still doing well. They may not keep calling, but they may not keep calling because they're getting this ongoing support from the Sprint team. This is not a real picture, but this is just a representation of a success story. This success story is going to be the everyday excellence for next month for the board. So I'm not going to go into a lot about it, but I will say that many of you have probably heard this was a grandmother and her autistic son living in a library parking lot in their van. They had been in this van for, I think, 2.5 months, hadn't had hot showers I think the grandmother hadn't had a hot shower in a year. It had been several months since they had had just a shower at all. They had 3 cats living with them. It was just a lot that they were trying to deal with individually. When the team became aware of this, one particular day, the whole team kind of rallied around and met out at the library to try to support this family. At the time, there were just so many things that needed to be taken care of. Not only did, just trying to get them to talk to staff and providers and crisis workers was a big deal. That took a little bit to make that happen. I think it was eventually the grandson that felt comfortable enough to start talking with all of our providers, and then eventually kind of encouraged the grandma to be receptive to having conversations. But when it came action time, it was things like, the cats had urinated all over so many things in the van that the grandmother wasn't even wearing clothes. So there were staff that went out and bought clothes like within 10, 15 minutes to try to support her in that way so that she could be removed from the van. They were very concerned about the van. They were concerned about their cats because that was like family to them. So animal control came and assured them that the cats would be taken care of if they would receive the help. There was a neighbor next door who actually had been looking out for them. They were very concerned about losing their vehicle because that was all the possessions that they had, so he agreed to let them park the van at his home. He also agreed to wash all of their clothes and to provide that support. And then we had a grandmother who had a lot of medical needs. She had a lot of skin issues that had cracked open, a lot of bleeding. Well, there was fire EMS and the mobile integrated healthcare team that were right there attending to her needs. And again, I could go on and on, but this gives the flavor of all of the folks that were involved. Kiva Rogers was here earlier, but DSS played a tremendous role in this situation. They worked to get the individuals housed in an apartment temporarily until longer term plans could be developed. And so people were getting food for them in the moment. I mean, this is all of our county departments working together. And this is not just one case. They do this all the time. But I'm very pleased to say, I'll fast forward, I know that the son was able to obtain a group home placement, which he is thrilled about. And I know she, last I heard, was in a nursing facility and doing very well there as well. So it just shows the power of collaboration between all of our departments, and everybody truly came together, which is why we want to do the recognition next month. Mr. Chair. Go ahead.
It's my understanding that Mike Mabe and the library folks and Chelsea from Perkinson's, that they all had been helping also. It was amazing.
Yes,
yeah, I've heard,
yes.
yeah, so.
Yes.
One thing I would say on that, though, is that they have been there for a little while, and it came to my attention through social media. If people in the community recognize this and they're trying to help somebody, let us help too, and reach out to us sooner. Nobody ever reached out to me directly. I saw it through social media and called Kiva, and that's how we started this process. But we could have intervened a lot sooner had it not just been shared on social media, but it would have been shared with social services or mental health services or fire department. And so I just encourage citizens, if they come across somebody in need, to reach out to us sooner to get help for the people that are in need.
Absolutely. And we've done a lot of education, too, with our county departments to let them know Sprint is available. So if they're getting calls, they've been a great referral source to us as well. Just fast forward in the future, this is something that is coming down the pike. We are really paying attention to this, but it is the goal of the Virginia CSB system to move all community service boards to certified behavioral health clinics by 2028. This is the national best practice standard for community-based behavioral health. It does require a coordinated approach to physical, primary, and behavioral health care. We do all of that now. The primary physical piece that we would have to work out through either some contracts or determining how we can provide more primary care within our service delivery system. But the CCBHC model demands system standardization, accountability, and evidence-based practices. I am on the state's review team looking at these standards, and I can say that all of the evidence-based practices that they require, we already do within our department. Also, a big point of contention across the CSB system is that folks are kind of pushing back on the requirement to be accredited because they feel like that's an expense and a lot of demand on their resources. Well, we've been fully accredited since 1997. And so, again, I feel like we're very well positioned if this is the direction the system moves in. We're accredited by CARF, the Commission on Accreditation of Rehab Facilities. Our next survey is in 2027, and it's our understanding they just came out with CCBHC standards that boards can be reviewed by. So we'll be pursuing that if this continues in that direction. So can't do it without our partners. I have them listed here, but we also can't do it without our senior team. So I would like to please ask our senior team to stand. Some couldn't be here today, but we have Danielle Sayer, who's our finance director. We have Doug Bilski, who's our assistant director for clinical services. David Meadows here, who is our assistant director for community services. And we have Nicole Carter, our human resources director, who is all here today. We also have Tim Adams, our director for planning and quality, Dr. Angelo Catalica, our medical director, and Brooke Cook is our administrative assistant. And they're not present, but everybody has a key role in what we've presented on today. And I'd also like to ask our board members to stand as well. So I'll entertain any questions at this point.
I think if we have any, we can catch you at dinner.
Sounds good. Thank you.